Three, two, one. During a recent meeting between U.S. President Donald Trump and French President Emmanuel Macron, cameras captured something unusual. Trump's hand appeared to have visible yellowish marks or scars on the skin. These images quickly spread online, sparking a wave of speculation. Was it bruise, a skin condition, or something more serious? Soon after, the White House responded. A press secretary confirmed that the president is experiencing a medical condition known as cranial venous insufficiency, or CVI. Now, many people are asking what exactly is CVI, and Creative rarely explains those strange marks. Okay, let's take a closer look at what this condition is, what causes it, and why it might show up on someone's hands. Okay, so what is cranial venous insufficiency? Cranial venous insufficiency is a medical condition where the veins have trouble returning blood back to the heart. Normally, veins have tiny valves that keep blood flowing in one direction outward against the gravity. But in people with CVI, those valves do not work properly. As a result, blood can flow backwards and pull inside the veins, especially in the lower parts of the body. This extra pressure in the veins that can cause visible skin changes, discomfort, swelling, and even ulcers over time. CVI is the most common thing in the legs because that's where the gravity has the biggest effect. However, in some cases, especially with age or poor circulation, other areas like the hands or arms can also show symptoms. Why would it cause yellow scars? One of the signs of CVR is skin discoloration. Over time, when blood sits in the veins instead of moving upward, red blood cells break down and release a pigment called hemosiderin, which contains iron. This iron gets deposited in the skin, leading to brownish, purplish, or yellowish patches. These patches often start as a dry or itchy skin. Later, the skin can become sticky, leathery, or shiny, and in some cases, it may form small scars or even wounds if the area has been irritated or treated. In Trump's case, the yellowish marks seen on his hand could be the result of hemosiderin staining, or they might be healed scars from previous ulcers or minor vein procedures. These marks are not unusual in people with long-term circulation issues. What causes CVI? There are several reasons why someone might develop a cranial venous insufficiency. Age. As people get older, vein valves naturally weaken. Lack of movement. Sitting or standing for long periods with much movement can affect circulation. Obesity. Extra body weight puts more pressure on the veins. History of vein problems. Varicose veins, blood clots, or leg injuries can all lead to CVI. Genetics, some people are simply born with weaker vein valves. It's also worth noting that CVI is more common in people who have spent years in sedentary or stressful environments, like frequent travel, tight schedules, and long hours of standing and the events. First, someone in a high-profile role like President Trump, these factors can add up over time. Is CVI serious? Cranial, cranial venous insufficiency is not life-threatening in most cases, but it can significantly affect a person's quality of life if not managed properly. Over time, the following problems may occur. cranial swelling, pain, or heaviness in the limbs, skin damage, and scarring. Venous ulcers increase the risk of infections. In rare cases, deeper vein issues like blood clots. So while the condition may seem minor at first, just some skin discoloration or swelling, it can get worse without medical attention. Could it be treated? Yes, CVI is treatable, especially when caught early. The goal is to improve circulation and reduce the pressure in the vein. Here are the most common treatments. Compression therapy, wearing compression, thus the word sleeves can help veins push blood back towards the heart more efficiently. Lifestyle exchanges, regular walking, elevating the legs when resting, and weight control all help circulation. Meditations, some drugs help reduce swelling or improve blood flow. Minimally invasive procedures. If the condition is severe, doctors may use laser, heat, or chemicals to close off damaged veins. Whenever for patients with ulcers or open skin, medical cleaning and depressing are essential to prevent infection. These treatments can reduce the symptoms, prevent complications, and even make some of the visible signs fade over time. Why is this in the news? The reason people are paying so much attention is not just because of Trump's health, it's also about visibility. When a public figure appears with visible marks or health-related signs, it naturally draws the public curiosity and concern. Some people jump to conclusions online, speculating about injuries or something more secretive. But the official statement from the White House gives a straightforward medical explanation. In a way, this situation also raises awareness about the conditions that affects millions of people, but often goes undiagnosed or untreated. What can we learn from this? Cranial venous insufficiency may not be a household name, but it's very common, especially among people over the age of 50. Many people live with it for many years before realizing what's going on. By seeing discussed in the news, more people might recognize the symptoms in themselves or loved ones, like swelling, aching legs, or an unusual skin patches, and decide to seek medical advice. It's also a reminder that circulatory system, while mostly invisible, plays a crucial role in how we feel and function every day. And in the end, even powerful leaders are immune to the effects of aging and poor circulation. So what do you think about this video? If you like this, please do not forget to like, share, and subscribe.